So this morning we had very interesting conversations and debate around the concept of planning in healthcare, the workforce, planning workforce, in the context of the joint action here. The conversation was very inspiring because it highlighted, first of all, the importance of working together, even if 27 different healthcare systems, even if different languages, this joint action managed to leverage experts that put forward a framework for reflections on one of the most important challenges that we will be facing in the future, which includes the shortage of workforce. The meeting today highlighted how important it is planning in the context of strategic investments for Europe, a systems and a tool that will help our policymakers reflect, understand, listen, and act for the future of our health systems. Our health workforce, it is the cornerstone of our health systems and therefore the cornerstone of innovation and competitiveness in Europe. So this Today, we heard a lot the concept of ecosystem and the role that planning does in learning ecosystems for health in general. When we talk about ecosystems, we look into it with the framework of, let's say, regulations, organizational changes, technological innovation, and cultural and ethical improvements. Among the most important innovations when it comes to regulation is the European Health Data Space and the work that we are doing on artificial intelligence. The European Health Data Space already today promises to unleash the power of health data in Europe in a way that is lawful, that is trustful, and that it generates confidence both in the patients and in the professionals that will be using it. Now, generating evidence, including for planning of healthcare workforce, requires access to large amounts of data. And this is what you will get when we will implement in full the European Health Data Space. It will enable citizens to travel safely across Europe because their health data will be accessible notwithstanding the differences in terms of languages and the health systems regimes. And it will also enable researchers to use this vast amount of data for policy making, for producing innovation, and for essentially developing artificial intelligence systems that will certainly contribute to the transformations of healthcare in the years to come.